Hi, I'm Abhay Gupta. I'm a board-certified plastic surgeon. I'm the medical director of Gupta Plastic Surgery here in San Diego, California. Welcome to the website. This is a section where we have some videos to address some of the more commonly asked questions that we get from patients on a day-to-day practice. We see a significant amount of patients who require reconstruction after massive weight loss. So bariatric surgery where they have stomach stapling or gastric bypass procedures, or people who've lost a significant amount of weight through diet and exercise modifications. So we do have a particular specialty in weight loss reconstruction. And one common question we get asked is, will insurance cover this procedure or not? And what kind of options do we have available to improve the shape of the body after a significant amount of weight loss? Both excellent questions. In terms of the options available, basically wherever the patients, after they lose about 80, 100, 150, even 200 pounds, as you can imagine, they're going to have a lot of extra skin hanging around that used to be stretched by extra fat that they had on their body. Once you lose the fat, the skin doesn't tighten as quickly, and they're left with extra hanging tissue. So we can surgically correct any of those areas wherever a patient is unhappy, and that's from head to toe. So their head and their neck, their face, they can have extra neck skin, extra face skin that sags, extra eyelid or eyebrow skin, and that can all be tightened during brow lifts, eyelid lifts, face lifts, neck lifts. The arms, they tend to get extra tissue hanging on the upper arm on the inside here, and that's certainly something that we can easily tighten. We do what's called a brachioplasty or an arm lift, where we make an incision along the inside of the arm, remove all the extra skin, and tighten the shape of the arm. The same thing can be done on the chest. In a male with extra skin on the chest, or a woman, extra breast tissue hanging down, they can get a breast lift and implants. In the male, we can do a breast lift and skin tightening. Extra skin on the back, upper back, in the bra line in women, and the men just on the upper back, and so that can be excised with well-hidden incisions, well-hidden scars. One of the more common areas is the tummy. A lot of extra skin hanging around the tummy and then the sides and the back and the flanks, and that can all be addressed with a tummy tuck or a body lift or a lower body lift. They're all various terms out there that essentially mean the same thing, which is removing all the skin around the trunk, tightening the tissues that are there, tightening the loose muscle layer that's there, and get a better shape to the belly. And then the lower extremity as well, there's extra tissue hanging around the groin area, the thighs, on the inside of the thighs where the skin might rub together, on the outside of the thighs, or even the knees and the ankles. All those areas have extra skin that we can certainly address and tighten. All of that can usually be done with well-hidden scars designed to improve the contour and at the same time remove all extra skin. Whether or not insurance covers it comes down to, more significantly, unfortunately, the ultimate decision is up to the insurance company, but it comes down to each individual insurance company has their own list of requirements that must be met in order to prove medical necessity. Usually they're looking for a certain amount of skin hanging down at any particular location, and that has to be documented with pictures. They're usually looking for some sort of complication from the extra skin, such as skin rubbing upon itself to the point where a rash develops, or an infection, or even an open wound or an ulceration, and that would prove that there's medical necessity to remove that extra skin to avoid such problems in the future. Some insurance companies require a documentation of back pain or neck pain or shoulder pain from extra skin weighing down on the shoulders or the arms or the chest, lower back pain resulting from extra skin weighing down in the abdomen. Unfortunately, it's highly variable depending on the insurance company, and the only real way to know whether or not insurance companies would cover the procedure is to come in, get a consultation, discuss all the options, and then we can submit to the insurance company for coverage to find out whether or not that's something approved. Certainly at home you can look through your medical plan, your medical booklet, to see what kind of exclusions or inclusions there are in there to give yourself an idea of whether or not your insurance company has particular procedures addressed in there. Otherwise, I'd certainly be happy to meet in person. If you want to come in for a consultation, just call 858-621-6000, and I'd be happy to see you here. We can discuss all those options and see whether or not insurance would cover the procedure and see which procedures are best for you. Otherwise, I encourage you to hang around the website and look at the other videos, and thanks very much for stopping by.